welcome to our next webinar in this Health and Safety Month. Today's webinar that I'm proudly bringing to you is Championing Mental Health in the Public and Healthcare Sectors. My name is Kate Mahiris. I am a Regional Director of Operations here in Health and Safety at WorkSafe, and I'm really happy to be hosting today's webinar. And I'm even prouder to be joined by this amazing panel of experts that I will introduce to you all now. So first up is Jen Fry. Jen is the Director of WorkWell at WorkSafe Victoria and leads a passionate and skilled team who have created the WorkWell suite of products, improving the mental health of Victorian workplaces. Good afternoon, Jen.
Good afternoon, and thanks, Kate.
Thank you. And Danielle Moss is a social worker with over 20 years of clinical education and leadership experience across Victorian public hospitals. She is leading change across a consortium of 14 healthcare services. Hi, Danielle.
Hi, Kate. Thanks so much for having me.
Excellent. And finally, unfortunately, Grace Norrie from the Community and Public Sector Union has come down unwell this morning. So sending our best wishes to you, Grace, but we are lucky enough to have a step in, Peter Lillywhite, who is the branch president of the Community Public Sector Union and is also the lead of the project that the union has created, Vicarious Trauma Prevention and Awareness Toolkit. Hey, Peter, thanks for joining us at last minute.
Thank you, everyone, and thank you, Kate.
Excellent. So, as I said, today's webinar is all about championing mental health in the public and healthcare sectors. So for the next 45 minutes, we're going to hear particularly from Peter and Danielle about their projects and share their evidence and experience about how they are successfully influencing and improving mental health outcomes for workers in Victoria. We're then going to come to you, the audience, where you can ask a question using the live chat box that you'll find on the right-hand side of your screen. Feel free while you hear from Peter, Danielle and Jen to add your questions to the chat box, and then when we come to it, I will put them to the panel. And I just wanted to note that some of the content today that you hear may be triggering, and it may be sensitive of nature depending on your own circumstances. If that happens, please feel free to take a break, go have a chat to someone. You might want to access your employee assistance program if you're at work today. You can also contact Lifeline on 131114 or lifeline.org.au. All right, so let's get straight to it. Okay, so Jen, I'm going to start with you, naturally, being my colleague here at WorkSafe. The WorkSafe WorkWell program is championing leaders to create system-level change for preventing mental injuries. To do this, you and the team here have funded over 30 projects for more than 13 different industries. So could you give us perhaps a bit more of an overview about how the projects were chosen for this partnership through the Mental Health Improvement Fund? And broadly, how is that collective work progressing?
Look, thanks, Kate. I think to start off with, it's just really acknowledging how important this work is. And that is because, 1 in 5 Victorian workers have probably taken time off work in this past 12 months because they do feel stressed or they do feel anxious or they're depressed. And unfortunately, work itself can contribute to this poor mental health. So here at WorkSafe, we're really invested in looking at how do we prevent that. So what is it about work that we can prevent people moving into this poor mental health that is caused by work? And that's why we've invested in WorkWell. And the WorkWell projects, which we're going to hear in depth about 2 of them today, is really about building the evidence base. It's about testing new approaches, but very much around what is causing. So what is the design of work that's causing poor mental health? You asked how we chose them. Look, it was a competitive process. So we had an application process, and organisations had to apply, had to demonstrate that they were actually going to really address prevention and really build the evidence. And so we do have 25 different organisations that are leading these projects. And as you said, they're across a whole range of industry sectors. And these projects, they collaboratively problem solve. So they work in partnership. And I guess, today we're going to really hear about how they do that problem solving. And it is unions working together with employer organisations, with workers themselves, with academics, with evaluation experts. So we're bringing together, I think we've got 530 partners in these projects that all work together to collaboratively problem solve and come up with how to actually prevent mental injuries. And you asked us what we're learning. Look, we've learned so much. And we're really now at this, let's share the knowledge about what we've learned. In a nutshell, it's actually about how leaders have improved confidence to assess the work-related factors that impact mental health, and leaders having improved capability, and it is around the evidence base around what works.
Yeah, wow. I think that is the catchphrase of the day, collaborative problem solving. I'm going to take that one away. Jen, can I stay with you though? And we are going to hear a bit more about two of these projects in great detail, as you said. But I just wonder whether you could talk to us a bit about work-related factors, because as I understand it, these projects that we're about to hear about are really looking at things like trauma, job control, and there are other work-related factors out there. Can you explain to us what are they and how are they health and safety hazards?
Yeah, look, absolutely. And part of it is actually having a language around, psychosocial hazards that everyone can actually understand. So we talk about these 11 work-related factors that are part of the design or management of work, and they can either positively or negatively impact employees' mental health. The great thing about them is they focus on things that can be managed, that can be changed. And it really brings it down to a practical level. So the work-related factors are things that you just mentioned. So things like role clarity, management of occupational violence, management of trauma, management of change, how we reward and recognise people. So they're all really quite practical things. But if they're managed well, that really contributes to a positive workplace culture. If they're not, they can become psychosocial hazards. And what we mean by those is that the things that actually contribute to stress, and they can actually cause both psychological and physical harm. But when leaders take a proactive approach to establishing a work environment that addresses the work-related factors, they can really develop a workplace that is supportive, inclusive, and can prevent psychological harm. So through these two projects, we're going to dig really deep into what that looks like in a practical sense, and how that actually leads to a prevention of mental injury.
Yeah, excellent. I think that's an excellent segue to get into WorkWell in action, as you said. So let's turn to those case studies. I might start with you, Danielle. Tell us a bit about the Thriving in Health project. Where did the inspiration come from, and what are you trying to achieve?
Thanks so much, Kate. So Thriving in Health, as Jen sort of mentioned, we started in 2019, so before COVID. And there was a genuine interest and concern about the wellbeing of the healthcare workforce with increased experience of stress, of burnout, exposure to trauma. These factors were happening, and there was a real interest in what we could do to prevent people from becoming unwell. So we know that healthcare workers make up 14% of the working Victorians, but we also make up 29% of mental injury claims that are going into WorkSafe. So that's a real concern. But we know that the work in health also has a number of factors, that some of them inherent, that can impact on stress in the workplace. So it's an unpredictable environment. We work 24/7, 7 days a week, every day of the year. We have exposure to some things in our workplace that may be more common for us, like that, potentially traumatic events as well. And there can be multiple risk factors or multiple organisational factors that come into play at the same time. So we came together as a group of hospitals and with industry to actually work collectively to identify what the issues were for us, and to work together under 4 projects, which I'll talk a little bit a little bit about before. But we want our workforce to thrive. The intention is a thriving workforce, and to do that, we know we need mentally healthy workplaces. So we had to act. We couldn't not act, and so we've come together over the few years to actually explore some of the hazards that Jen was talking about just before.
Yeah, excellent. Could I just stay with you though, Danielle, now? What about partnering with industry and academic experts? I imagine that in itself is quite a big project. So what does that overview look like? What are you doing to influence action in both of those groups?
So we actually have 4 projects that are running, and we've partnered with mental health experts and also with design experts. So our partners include the Black Dog Institute, organisational psychologists with the FBG group here in Melbourne, but also with a design professional from RMIT University here in Melbourne. And so we're drawing on the knowledge, obviously, of the experts, because it's really important that the work we do is grounded in evidence, but we're also drawing on the knowledge and the skills and the expertise and wisdom of the workforce, because we know that there's so much wealth in knowledge there. And we want to raise awareness about the mentally healthy workplace, what it is, with that group. And given the demanding work of the environment it is, it's really important that we do work together collectively. I guess it's to bring together that diversity of thought as we move through understanding these factors.
Yeah, excellent. Thank you for explaining that. I imagine that's where Jen talked about that collaborative problem solving really comes to play. Could you just expand, and you mentioned this just before, on the actual innovative initiatives that you are working on, and why are they so important and relevant to the healthcare sector?
Thanks, Kate. So Jen talked before about the importance of being able to, arm our leaders with the information and knowledge that they need. So one of our projects with the Black Dog Institute is actually looking at exactly that. It's how can we, build capability and capacity in our leaders in health to understand psychosocial hazards, because it is quite an emerging concept and even the language is foreign. So we looked at an opportunity for us to be able to work with leaders using some online education to introduce them to workplace mental health, understand psychosocial hazards, and also understand how we might work through managing that. So that's one of our projects. We have another project with the Black Dog Institute, and this one actually focuses on the factor of job control. So understanding that job control is a modifiable factor, but understanding too through literature that there is a concern about the high job demands and low job control contributing to poor mental health. So we're actually looking to target our nursing cohort with some education and participatory action to understand how we might be able to enhance job control with those nursing staff. We're also looking at a project to understand how we might better respond to critical incidents in the workplace, so those potentially traumatic events. And so we're working again with organisational psychologists to look at a systems approach to that particular piece of work. And finally, we're working on something really innovative with a designer to understand how we might be able to use design to prevent mental injury and create those mentally healthy workplaces.
Yeah, wow. You really went through some of those work-related factors that Jen mentioned before. So that makes a lot of sense. So thank you, Danielle. I'm now going to come to you, Peter. As I mentioned at the beginning, your pilot project is focusing on one really specific factor, I guess, which is vicarious trauma. So can we start back at the beginning, though? Can you tell us a little bit about what is vicarious trauma? And could you give us an example about how it could be identified as a psychosocial hazard in workplaces?
Of course, Kate. Vicarious trauma basically is a psychosocial hazard that is involved in dealing with other people's trauma. So you're not experiencing the trauma directly yourself, but you're speaking to people, reading reports, watching audiovisual reports on people who've been through trauma. When you're doing that sort of work, you're often more empathetic than other people in industries. And being empathetic, you sort of sponge up those traumatic details. Vicarious trauma is essentially post-traumatic stress disorder. So everyone's heard of PTSD. That's, of course, where you are exposed to the trauma yourself. But there's also a fundamental shift in worldview that's associated with vicarious trauma. So you might start thinking that the world is fundamentally unsafe in a way you never thought of before. In terms of a workplace hazard, we could call it exposure to traumatic content, as I said. Now, some of the common examples I've already given, but it's a broad spectrum, and it's a risk in so many parts of the Victorian public service, because the public service is a service department. It's dealing with people, and very rarely we're dealing with people who are happy with what's happening. We're dealing with people who are having problems, who are needing assistance. So almost every part of the VPS, there'll be some section in that department that'll be exposed to vicarious trauma.
Yeah, wow. I totally can relate, Peter, having started my career in health and then obviously now working for WorkSafe in this space. I wonder, though, whether we can, staying with you, sort of delve a little bit deeper into the project that you've been leading, which is the Vicarious Trauma Prevention and Awareness Toolkit, which is now an online resource. How is that then helping workplaces in the government sector to prevent the vicarious trauma that you just so clearly described for us?
Thanks, Kate. You mentioned the Vicarious Trauma Prevention and Awareness Toolkit, which is what the project was. We've finally launched the website, and we've called the website Preventing Vicarious Trauma. I think there'll be a link to that website later on. Now, this website acts as a reference point and a guide for employers to A, learn about vicarious trauma, and B, how to implement organisational prevention of vicarious trauma. And it's the organisational prevention that's really important, because for the last decade or so, we've been addressing most of the psychosocial hazards in terms of how to make the employee more resilient to the trauma, the hazards they're exposed to, and then also how to treat them if they've been injured. What we're trying to do is get departments and employers to look at what it is that's causing the harm, and can that be removed or can it be reduced? And we're also looking at factors that may contribute to the hazard, and that's where the work-related factors or psychosocial hazards come in, because none of these things act in isolation, and they all compound and contribute to the hazard that you're working with. The website it combines information on vicarious trauma and organisational prevention, but it puts it into the Victorian context, as in the state of Victoria, and it's firmly grounding in Victorian occupational health and safety guidelines. This website will help employers in the government sector, but it's also generalised enough that it will apply to workplaces across Victoria.
Yeah, excellent. So, Peter, what you've just described, if I can come to you, Danielle, I would have to imagine, and having worked in that space in myself before, frontline health workers are probably exposed to trauma as well, along with other psychological hazards, as we talked about. What have you learned in regard? What does vicarious trauma look like in your space?
Thanks so much, Kate. You're absolutely right that exposure to potentially traumatic events or content is one of those hazards in our workplace, as is vicarious trauma. And over time, all of our projects have adopted a similar approach. So we've actually gone through a process of research and understanding the literature. So we've had over, I think it's about 9,000 articles reviewed through systematic reviews with our partners to understand what's happening from a best practice perspective. And we've also consulted with our people. So we were lucky to be able to have a window of opportunity to survey nearly 900 healthcare workers to understand a little more about psychosocial hazards that might be present in the workplace. So it was a really, not an easy thing to survey our people during a really, really tough time, but we've managed to do that and also have consultation and focus groups as well. And we found some key hazards that our workforce at the time were facing. And I think these are hazards they continue to face. So understanding job demand. So job demand is a significant hazard. And we found data in terms of that being cognitive demand, but also emotional demand. So cognitive demand, the need to pay attention sort of constantly during the day at work. And then emotional demand, as you say, is the context of the work that we do in health. We work with people who are sick, who are injured, and people who are dying. We also work with their families and the community as well. So we understand emotional demand also as a hazard. Low job control, I mentioned before, where people have low control over how the work they do is done, discretion about that. So that was another hazard identified. We also had supervisor support. So if there was low supervisor support, the feeling that you're not cared for, that that was a hazard as well. And the other one was praise and recognition. So when that was tokenistic, obviously not well appreciated. So it was quite significant. The feedback, the consultation, where people were looking for that thank you for the work that they're doing. So absolutely, there's certain psychosocial hazards that we encountered in the purpose of this piece, but I know that there's a breadth of hazards and that they do operate not just on their own, they can operate together.
That real intersectionality that we are very conscious about. Peter, can I come back to you then? I understand one of the insights from the project that you've been leading is that it is important to normalise the trauma in working environments that both yourself and Danielle have spoken to, where that exposure is happening. Can you give us a bit more insight into what this means, but also why is that important to bring that exposure to the forefront?
Certainly, Kate. It's about acknowledging that risks come with empathetic engagement to traumatic content. A comparison, for instance, would be jobs where there's significant physical risk, like working at heights or underwater or welding. The risk is acknowledged, but it's not for a lot of the psychosocial hazards. Where there's a risk of vicarious trauma, we've found that risk, as I said, it isn't openly acknowledged. People do experience it, and there are other mental health impacts, such as burnout, but there's often an emphasis on resilience, as talked about before, rather than preventing the harms at an organisational level. Knowing that vicarious trauma is a risk inherent with the job means that an organisation has to prevent it in line with the current occupational health and safety regulations. And I might add, when they come out, this will be further emphasised with the psychological health regulations. It also helps move away from the attitude people can't just cut it in their line of work, which is always the way, I don't like the heat, get out of the kitchen sort of thing. Now, the other problem is that with many psychological health risks and issues, people are afraid of speaking up about them. And this means that they go unnoticed by an organisation. If you can normalise, in this case, vicarious trauma, and people understand it's a risk, and an organisation understands it's a risk they need to deal with, then people will talk about it. They can raise it, and it can be addressed earlier. People aren't afraid that they'll be penalised under their performance plan, or they'll be, told they should find other work, etc.
Yeah, that's speaking up. There's sometimes a lot of barriers to that. And we definitely hear about that here at WorkSafe as well. So, Peter, can I just stay with you for a little bit longer? We just heard a little bit about the intersectionality Danielle mentioned with other factors. But exposure to trauma can be impacted by other work-related factors. So really them sort of impacting vicarious trauma. Can you share what the project that you've led has found in this regard?
Yes, certainly. Well, first I need to point out, which I didn't before, that vicarious trauma is a cumulative trauma. And that means that you might get exposed initially and think nothing of it. But all of these things build up. It's one of our pilot site employees talked in terms of a backpack that you're putting rocks in. You throw a small rock in, don't notice it. Throw another one, don't notice it. But eventually that backpack becomes heavy. And eventually it's so heavy you can't move. And then, it's too late. So without that exposure, you're not at risk. But there are other work-related factors that impact that risk. Now, literature on vicarious trauma talks about work-related factors or psychosocial hazards. And I think there are a few mentioned in some of the talk that's gone through, so I won't go over those again, but just point out one or two things like high workload. Obviously, if you've got high workload or high caseload, not only does it make it more difficult to do your job, but it probably increases your exposure because you're dealing with more of these traumatic events than you would if you had a lower caseload and a lower workload. Poor supervision was mentioned a couple of times. And a supportive environment with the supervision. We found when we were doing our work that supervisors were saying they wanted to help their staff, but they didn't know what to do. And they didn't want to raise vicarious trauma for fear it would be making matters worse. So some of the things we did with work with supervisors, doing reflective practice on the best ways forward so it was trauma-informed reflective practice to work the best way forward for the supervisors to deal with their staff. And that's very important for staff to feel confident, again, as mentioned before, but feel confident speaking to their supervisors or their line managers, and the line managers being confident enough to have that conversation. These conversations, as I said, need to be around the work, not around performance.
Yeah, really important messages there. I mean, I'm really hearing you talking about that identification and that addressing those work-related factors and hazards. It can be quite challenging, and that intersectionality is something we really need to be aware of. Maybe, Danielle, can I come to you? No doubt your project has come across this. Do you have any insights from what we've just heard about from Peter as well?
If you could just bring me up to speed a little, Kate, because I just got out.
That's okay. We were just talking about the work-related factors having an impact on vicarious trauma, and Peter really talked about them often being present together, and we really have to think about that in the workplace context. So in health, what does that look like?
You're absolutely right, Kate, in terms of psychosocial hazards can occur together. And I like to think of them sort of that honeycomb, that they can be standalone, but then they may interact. And it's certainly one of the things we do notice, for example, our critical incident project, that it may not be an incident itself, but it may be the support that's provided afterwards that could be the hazard. So there's certainly things that can intersect together. But I guess what's really important is our proactivity with our risk management, is understanding what's happening in our space, and looking for and being proactive about understanding psychosocial hazards. Because once we identify them, we have language around them as well. We're better placed to understand what we need to do. And that certainly is about how we then go addressing the risk that hazard might present to our particular workplace. And it's really important that we understand the hazard at its source. So we understand what's happening, and then we can go to the source to try and work with that. So, there is existing perhaps data sets that might give us an inkling of what's happening in our space, that we can actually look to and say, this is a bit concerning for us, but what does it mean? And so that's when we need to start unpacking and identifying, so that we can move on to understand the risk that something might present to our people. So it's about not waiting for something to happen to start this process. We need to be proactive about that. And we need to have a process in place, continuously, to be understanding what hazards may be present and then understanding what we need to do about them.
Yeah, amazing. Absolutely. Proactivity is better than cure. So thank you for those insights so far, Jen, Peter, and Danielle. We are now going to go to the questions, which are coming through thick and fast to the right of me on the chat screen. So we'll go for questions for around the next 10 minutes, and then we'll come back to wrap things up. So, who's going to put this question to? There's a very popular question here, and it is, who is best placed to investigate psychosocial incidents? So I might stay with you, Danielle, because you just talked about, sometimes that can actually be the hazard when, after it's happened, what happens to investigate or review, if you would like. Is it better to have health and safety or HR? That's the question.
And it's a really good one, Kate, because I think what we understand with psychosocial hazards is that they can be different from a physical hazard. So it's not simply about removing a trip hazard, but psychosocial hazards are really complex. Sometimes people have called them the dark matter. You can't see them, so it's hard to know if they're there. And I think what we're seeing more and more is about having that integrated approach. So understanding that we all come with incredible skill sets, so that we have OC health and safety, we have HR, we have health promotion. But I think we're also seeing with psychosocial hazards the need to have the social sciences in there as well. So I would absolutely say that it'd be great to work towards a model that sort of had that multidisciplinary approach, where people came together to understand that we shared that skill set together, and that we worked together to co-design what it looks like to manage those hazards. So I think it certainly is an approach where there is many people that can contribute to that, not just one particular profession.
Yeah, excellent. Peter, do you have any thoughts or views on the question?
Yeah, no, I agree with everything Danielle said, but I'll just add to that we still have a long way to go education-wise. So your HSRs are an obvious starting point, but they need to be educated on psychosocial hazards. They're very well versed in the physical hazards, but that hasn't happened. A lot of organisations have their own health and safety officer. They need to be brought up to speed. WorkSafe, the regulator is working on that as well with training for their inspectors. The unions, we're well versed now because we've been working on this project. We have a subject matter expert on the team, but other unions are starting to get to that point as well. So I think that's the main thing, that it's still early days. And as I said, with the psychological health regulations coming up, there's still a long way to go for education for all of those parts.
Yeah, really. I think that's really important, Peter. Thank you for answering that question. The next one that's come through is around when people are so busy with work, how can we help them manage? What can you do to make sure work is good for mental health? So I guess sort of there's a couple of questions in there. I mean, Jen, any insights for you? You lead a large team of people. When people are so busy, how do we help them manage? How do we try to balance the output that's sort of expected, but recognising the mental health aspects?
I think part of it is not getting overwhelmed. And I think that's where, as Danielle and Peter both said, that being proactive and thinking about the work-related factors, having a shared language around those, and making small changes, bit at a time, so that it just doesn't become, what was it, Danielle, the dark matter, that it just becomes such a huge, big, overwhelming area that we actually pull it right back down to, okay, let's really understand the work-related factors. If we're talking about healthcare and public sector, we do have our people matter survey data that comes in. Look at that, use that, try and then dig down into your own teams and say, well, what are the work-related factors that are most important to our staff? Then how do we then work on those one at a time? Noting that they do interrelate, but making sure just bite little bits off. And also integrate into your current processes. People are pretty good at doing physical risk assessments. Think about this in the same way. So just have a different language, but use the same processes, build on what you've got so that you're not trying to reinvent something that just feels too big. So small bits, use a shared language and use existing processes is probably my advice.
That's great. Great advice. Thank you, Jen, for sharing some of your insights. I guess maybe I'll start with you, Peter, on this question. It's quite specific around if an employer hasn't looked at or the work-related factors, and in this question's put the 11 work-related factors, so kudos to them. They've paid attention. Can they say they're providing a safe place to work? If they haven't even looked at sort of what we've talked about today, do you think they can say they're providing a safe place to work?
Interesting question, and there's probably lots of different answers to that. Certainly once the psychological health regulations come out, that'll be very clear for them. But I think even under the existing, in fact, I know under the existing Health and Safety Act, you have to provide a safe work environment, and that includes safe for mental health. Now, if an employer hasn't addressed or even understood the 11 work-related factors or psychosocial hazards, then they may still be providing a safe and healthy workplace, but they can't go back and show evidence on what they've addressed. They need to start looking at those psychosocial hazards, and they start looking at their organisation, speaking to their employees and saying, well, what does this mean? What does this psychosocial hazard mean? How does it relate to our workplace? They need to do that. So, yes, they might still be providing a safe workplace, but they can't prove it.
Yeah.
And if they can't prove it and they don't know, then something's going to go wrong down the track.
Yeah, I think that's really sound advice and connects back to what Jen said is, talk to your team. What are the factors here that are relevant to us? Absolutely. All right. Lots of questions here, guys. So stick with me. Danielle, what can we do when there is no clear process for how psychosocial incidents are investigated? And we can't guarantee this confidentiality is coming up, I guess, in this question. So, I'm guessing this person who's asked the question might be in a workplace where there isn't a clear process. What is a clear process for reviewing psychosocial incidents? Can you give any insight into that?
I think, as Jen just said, we're learning how to utilise the existing systems that we have to be able to manage something that's really relatively new for all of us. So I think we need to think too about a local context of the workplace as well. We need to understand that local context is important. I think it is, understanding psychosocial hazards, as we say, it can be hard because they're not going to be seen. Understanding the risk that they present to, again, can be hard. But I think it's important to have perhaps multiple avenues of how someone may be able to help understand or identify or feedback concern about something. So by having, we have data sets that Jen mentioned that are already available that might be once a year we find out, but also having other avenues like internal surveys or internal checks, pulse checks, having the ability for someone to anonymously perhaps give some feedback. There's also examples out there of having those whistleblower hotlines into organisations so that people who may work there who don't feel comfortable speaking about something may be able to use that avenue to raise a concern. So I think it is, we will be navigating this journey forward with everybody and understanding how we do absolutely maintain confidentiality as we work through these processes because we are looking at, big sort of systems change and we do need to make sure that our workplaces are safe, that people feel that they're able to speak up. That psychological safety is really important because we know when people are safe to speak up and we can reduce stigma, that we're able to work together better to work through these hazards and work that co-design and how we can prevent or come up with some way to control or manage them.
Excellent. Peter, can I ask you, sort of tacking on my own question, I imagine with vicarious trauma, there is perhaps an element of, people maybe not speaking up or being afraid, like if my name is against this, what's going to happen? What's been your experience with the project in how to tackle that in workplaces?
I might even just go one step further, Kate, because with a lot of these people, their job is engaging with other people's trauma. So they don't see it as a risk themselves. And so one of Danielle was talking extensively there in some cases about data collection. So the data is not collected. It's not in the incident reports. So some of the departments are now looking at ways that information can be gathered. They've even gone so far as to add a vicarious trauma question in exit interviews. So they can gather data, it'll be long term. They won't find out tomorrow how many people left partly because of vicarious trauma, but 5-10 years' time, there'll be a good data set. So as far as actually having people confident, well, first, you've got to educate people about vicarious trauma, explain to them it's part of the job, and have them aware that their supervisor, their line managers, their organisation understands that and wants to make sure that it's not a risk to them. Then the conversations need to become a regular part of the conversations. So whether it's at team meetings or general staff meetings, Occ Health and Safety Committee meetings, vicarious trauma has a line item on there. When you're having your weekly, monthly, whatever, meeting with staff, we're discussing how things are going. You don't sort of say to them, well, are you traumatized yet? But just make the opportunity for that discussion to take place so as that discussion becomes normalized. I think that's the most important part, that it's a normal part of the discussions and people don't feel threatened by it. We'll start to open up and say, look, I've been having trouble sleeping. There's some of these cases that are really playing on my mind and be able to talk about them.
Yeah. And that really goes back to your point about education as well. So if I'm a leader and someone is saying, I'm not sleeping well, picking up on those subtle hints, I imagine, is going to be a key part of responding to these factors. I think we've got time for maybe one more question. And so I might ask each of you to give a response to this because I think it's a great one. we can't answer part of this. When can Victoria expect to see the psychological health regulations? We don't really have an answer to that, unfortunately, in today's webinar. But what impact do we think they'll have in workplaces? So let's fast forward 5 years from now. We have regulations. We've perhaps adopted, some of the project outputs and things are happening. Danielle, what does it look like to you in 5 years' time?
I think, gathering just the conversation we've just been having now, the importance of the ability for people to all have that shared language and to understand what we're talking about, but then have the confidence to be able to speak up in the workplace about these issues. But we'll also then have the workforce collectively working together on ways to co-design the way our systems of work are managed. And that just becomes our regular practice. So I think having a shared language, as everybody's talked about today, is the important step, because I think that's what we're grappling with at the moment, is how do we understand things that we can't see really easily. So once we have that, it becomes that common knowledge, and it's a shared conversation around a health, around a health care setting. I would hope that we would be able to see, greater conversations, less stigma, and also that really collaborative approach to working together to understand these hazards and to be working on how we can manage them.
Yeah, thank you, Danielle. Peter, what impact do you think the regulations and the future work's going to have?
Well, I think firstly, and that's what I find really exciting, is that the psychosocial hazards and psychological health will be front and centre. As I said, it's already picked up under the Act. No one's clear what it's all about. So it'll be fairly extensive. And, I think that can only be a good thing. The other thing is, and this is a health and safety seminar, so hopefully most of the people listening will understand the term or be familiar with the term so far as practicable, and that will come into these regulations as well. But there's a hierarchy of control that people work with for physical hazards, and there is the same, not exactly the same, but same sort of thing proposed under the psychological health regulations. And so far as practical, you have to remove the hazard. And this is a quantum step forward in psychological health, that you look at removing the hazard. If that can't be done, then you look at either ameliorating the hazard, dealing with other contributing hazards, and then you look at education. Then you look at what I keep calling PPE, so personal protective equipment in physical hazards. I think of PPE as resilience training, mindfulness, all of these things to help you deal with the hazard. But these regs will force employers to try and look at, well, what do we do about preventing or lessening the risk in the first place? And I find that very exciting.
Yeah, absolutely, Peter. Thank you. Jen, just quickly, what do you think the impact the regulations and all the work in WorkWell, perhaps, that you so proudly been involved in, will have in, say, 5 years' time?
Look, Kate, I guess going back 5 years, just how far we've come. WorkWell started in 2017. It was a completely different environment. We didn't have this language around the work-related factors that impact mental health. I have to say, a lot of our earlier work, or what we were hearing, was around, supporting individuals. The conversation has changed, and I think COVID in some ways has probably turbocharged that there is an understanding that we can and we must design work from the outset so that it's psychologically safe. So I think there's been a paradigm shift. I think in 5 years' time, I'd like to think that at every board level, at every government department, that prevention of mental injury is everyday work and language, and that it is reported on, it is measured. And that we actually see that prevention of mental injuries is not only possible, but it's just how we do things. And so that we actually, this cultural change that we're seeing is embedded from board level down to every leader, that they actually have the language and know how to assess identify and manage the work-related factors that impact mental health.
Yeah, absolutely. Now, unfortunately, we are close nearing running out of time, or we have run out of time. So I'm going to come back to each of our panelists, I guess, to share to employers who are listening today, I guess in summary, what would you say to them? What's the first step to go about promoting a mentally healthy workplace? So, Peter, can I start with you?
Yeah, look, the first step would be to engage with your employees. They're the ones who are facing the hazards. They're the ones that understand the hazards, and they'll be the ones who'll have the first stages of what to do to prevent or to address these.
Excellent.
Hazards.
Thank you, Peter. That's I'd love that step. I think I will take that straight back to my team. What about you, Danielle?
I couldn't agree more with Peter. I think that we have a wealth of knowledge, a wealth of wisdom, of experience in our workforce. And I think we need to tap into that wealth of knowledge, because they're the ones that will be able to help us understand our organisations and our contexts, and help us to identify the areas that we need to work on, and how we might be able to do that work. So I think it's absolutely important for us to have that model of working collectively with our people.
Yeah, absolutely. And Jen, to wrap up from yourself, is there a summary message from WorkSafe you want to share today to those employers listening?
Yes, look, I do think that we're all learning, and I think, you know, if the message is investing in leaders, so investing in leaders so that they've got the confidence and they've got the capability to actually manage the work-related hazards, and doing that by assisting them with the conversations that they can have with their employees, and using the WorkWell toolkit. We haven't even mentioned it yet, but WorkSafe has invested in developing the WorkWell toolkit over the last 5 years. It's a fabulous online resource. It actually goes through the work-related factors, what they are, how to assess them, what to do about them, really practical advice. It's got templates, you know, so you don't have to invent the wheel out there. So there's policy templates, there's action plans, there's case studies, there's just a whole range of resources out there. So don't think you're on your own. Use the WorkWell toolkit, and as I said before, just one step at a time. Don't get overwhelmed by this.
Yeah, excellent. Thank you, Jen. So this is where I am going to say farewell to Danielle, Peter, and Jen. Thank you so much for today's conversation. It has been a blast. We'll see you another time. Thank you.
Thank you.
Thank you, Kate.
And so to all of you who have dialed in today, we hope that you found this an interesting and informative session. We have a lot more sessions on this week, so check out our website and register for more webinars where you can learn more. This webinar has been filmed and it will be available on our website next month, where you can watch it again or perhaps share it amongst your colleagues and networks. On screen shortly, we will note a sort of list of contacts, I guess, if you will, probably the link to the WorkWell toolkit that you just heard about from Jen, and other links where you can learn information about this topic, or perhaps reach out for further advice and education. And if you do have any further requests for information or advice, you can always contact us here at WorkSafe by visiting our website, calling our advisory line, or in an emergency, we do operate 24/7. So please do not hesitate in calling us. And just finally, I would like to also let you know, we'll be emailing each of you who have registered for a Health and Safety Month event, a survey that we'd love you to be part of. Everyone who enters will go into the draw to win one of 5 $100 vouchers. So get involved to be considered to be a winner. And the winners will be contacted by email in November. So thanks so much for joining us today. Go safe and see you next time.